Hello, my name is Sheila Ramilla, and today I'll be speaking to you about key issues of the electronic health record, some of the healthcare challenges that we face today, and this is in part of Healthcare Information Systems, a class that I am taking under Colorado State University Global Campus. As of today, the electronic health record has been adopted across many hospitals nationwide, and this goes back to presidential influence in 2004 during the State of the Union address that was presented to us by President George W. Bush. One of his primary focuses during that time was to provide every American by the year of 2014 with the electronic health record. Murphy also stated that in his Union address, he stressed that attaining the electronic medical record and computerizing health records would avoid dangerous medical errors while at the same time reducing costs and improving patient care. Additional efforts under the presidential influence of George W. Bush was also the creation of the Office of the National Coordinator for Health Information Technology, also known as the ONC. And the reason for the creation of the ONC was to have them overlook the nation's movement towards the electronic health record during his term. Other presidential influences involved President Obama. He continued these efforts after George W. Bush by allocating $30 billion of the American Recovery and Reinvestment Act of 2009 in support of health information technology and where we are currently at today. In addition to presidential influences, there is also mandated national efforts that come from Health Information Technology for Economic and Clinical Health Act of 2009, also known as HITECH. These efforts were to support the adoption of the electronic health record and health information exchange. Some of the key points under HITECH was the incentives that they provided to hospitals and eligible providers that were working towards becoming meaningful users, and that was to improve quality of care and better manage healthcare costs. Now, in addition to them providing incentives, the focus of those incentives were to help with purchasing and implementation of health information technology. HITECH, on the other side, imposed that there would be penalties for hospitals and physician providers if they failed to adopt the EHR in a meaningful way beyond 2015. So what do we mean by meaningful use? HITECH had 5 major categories: systems that are safe, timely, and effective, patient engagement, supporting continuity of care, ensuring population health, and also protecting patient health information. So where are we at today? Thousands of hospitals and over 500,000 physicians are active users of the electronic health record. But there are challenges that we face: interoperability, usability, and health IT safety. So interoperability can be seen as time taken away from patient care. An example would be Pyxis software interfacing with Epic EMR. Usability also involves the extent of the technology that we're using effectively or efficiently, and does it actually match employee workflow? An example would be pediatric patients and dosing of these individuals, since they have different physical characteristics. And last would be health IT safety that surrounds patient adverse events and unsafe outcomes. Framework was developed to define and measure health IT safety, such as workflow and communication, the clinical content, rules and regulations. And in addition to that, recommendations of involving accreditation agencies such as the Joint Commission, and just ensuring transparency in an environment can also promote health IT safety. As intricate as the EMR is, education should never be overlooked and should be part of the organization's budget. Also, leaders should set a time to do face-to-face interviews with the frontline staff so they can understand the frustration and burnout. In conclusion, recreating the EMR so that it's fashioned around the end user's workflow, their desires and challenges can help the staff and clinicians provide effective care to patients while at the same time working towards meaningful use requirements. Thank you.